Hello everyone. We are doing a new series on procedures that we do in the office because we constantly get people who say, I had X done and I wasn't happy with the results. Well, the reason you had X done and you weren't happy with the results is because they didn't do it as strongly, as therapeutically. I hesitate to say as well, but as strongly and therapeutically, let's say, as I believe that things should be done, because we all know that I'm about maximal strength. Now, you look at me, I've got a high-dose retinol restoration peel on my face because every now and then I have to do something with myself because I'm always tuning everyone else up, and I can't look like the old hag when everybody else is looking increasingly fabulous. So today we're doing Morpheus, and the whole series is on why things should be done in a particular way. Wait, don't do that, just let it soak in. Sorry. And because it soaks in, it just soaks in. So I'm talking about the numbing medicine. So I'm going to show you the numbing medicine on the patient, and when we do Morpheus, how we do it versus everybody else, which is what matters, okay? In the big picture, as far as results, and everything is about results. Now, it takes two people to do Morpheus, and blessedly, I'm going to introduce you to Valerie, who is my PhD PA, which means that she's probably one of the most experienced PAs in this country, if not the world. And she's worked with all the great masters who have taught her tricks, and the more tricks we have in our toolbox, the better it is. So she's up fiddling, as we all do in medicine, and with the numbing medicine that we have on our beautiful young patient. Our beautiful young patient is having Morpheus instead of Forma, which we often do instead, because she's moving, and this will serve her well for the next couple of years. That combined with skin products, everything she's doing internally, it will tighten up her neck, her eyelids, her face, and keep her increasingly youthful for a number of years. So sometimes we go to the stronger procedure that has some downtime, but in order to create beauty, sometimes we have to have a little bit of downtime. And so I'm looking forward to having it done here soon because I need it more than anybody, but that's beside the point. So first of all, let me introduce you to Valerie. Let's see if I can turn the thing around. I may have to stop it and we'll come back to you.
Okay.
So now here's Valerie.
Hi, everyone.
And she's basically going to be doing the procedure. Sometimes she does it, sometimes I do it. But when we do the procedure, the first thing we do, and you can see on this patient that we've got a very strong numbing medicine, not IMLA, which is not enough to do anything to anybody, but a very strong high-dose tetracaine lidocaine that we have on the patient. It stays on the patient for an hour, more like an hour and a half before we start the procedure. But she's also being sedated because in order to have Morpheus and to do the settings as high as you need to in order to get a very visible result that people are very happy with, you've got to sedate them, in my opinion. Remember, I started off as an anesthesiologist, so sedation is very important because we're not into pain and suffering. We're into maximal results and not into pain and suffering. And so the other thing we're going to do today on her is at the same time, because look, we're working on her face. Well, we blessedly, and let me just move you around the room so that you can see all the equipment it takes to do it, but we're blessedly also, we've got an InMode Evolve machine, and so while she's getting the Morpheus done, we're also going to tighten up her abdomen and for an hour. And then we tighten up her legs with Evolve Trim with her cellulite, which she says she has, but let's just say she's young and beautiful, and so but we'll tighten it up and keep her from having it in the future. Now, Evolve, oftentimes you have to do it, yes, you generally have to do it more than one time, but we do it much longer than most people do because, again, maximal therapy gives maximal visible results. So we're going to combine therapies, which we often do, okay? And what we'll often do is not with Morpheus, but what we may do at the same time, and you can't necessarily see it, but it's in the background there, but we may also blow CO2, carbon dioxide, into the abdomen or the thighs or the arms to tighten that up and turn on the stem cells, which tightens and helps rid cellulite and increases youthful skin cell production and collagen production at the same time. So we will often combine therapies. Now, this patient also has a little brown spot on her face, a light little brown spot, but it's a raised brown spot. It's not a skin cancer. It's just a little seborrheic keratosis that people grow. I'm not sure that we can see that, but a little one. But those are the things that drive us all crazy in this life. And so we're going to use a 532 laser that's in the background there that I'm showing you, that we will burn that off at the end of the procedure. And so as she heals, everything will go away. Valerie's pointing to it so you can see it. It's light, but those are the sort of things that, again, we all obsess about, women and men. So again, we're treating the whole person. We're looking at the whole person. We're combining procedures. We're maximally giving the maximal results that we can give. And there are a lot of people who do procedures like this. They'll do a couple of procedures that are much less. I personally think nobody has time, nor the money, nor the desire to do that. We do one really good procedure. And also, besides numbing her, besides sedating her, we're also going to inject numbing medicine into her skin. And hang on, I'm going to turn it back around so you can look at me with my skin peeling, so that we'll finish this discussion. But there's Valerie, and so we're introducing you to everybody in the office as well. Hang on. Okay, so I'm going back to the discussion on Performa, okay, which is another no downtime, excellent tightening laser. I think the best, strongest, no downtime tightening laser on the market. When we do those, we do 1, 2.5, 3 hour procedure for the face, eyelids, and neck. We don't have people come in once a month or once a week because my patients don't have time to do it, nor do I in the big picture. But at the end of the day, my patients get better results, not just what I say, but what they see. And so I may have people who do Forma once or twice a year, people who have no time for downtime. With Morpheus, I'm a huge fan of Morpheus. I think that without a doubt, it is the well-conducted, the way we do it, where we can numb people, we can give them a strong treatment with the right settings. So again, we're going to inject numbing medicine into her skin. She's sedated. She's got a strong numbing medicine on her skin. She's going to be very comfortable during this procedure. And then we'll show you at the end what she looks like afterwards, which is inconsequential. I mean, you look fine afterwards tomorrow. Look, what's the worst thing I can do to people is give them a bruise, okay? Because I'm sticking tiny little needles in the skin. That's why everything has to be numbed. And we'll show you the the tip as we start to do that. So, hang on, more to come. Okay, here we go. We've done half of her face, most of her face. As you can see, her forehead, her eyelids. You can see half of her neck is red. We're blowing the cool air on her to keep her brain where it's discombobulated, so she doesn't understand, so her brain doesn't really perceive anything. We've numbed her. We're almost finished. She's done really well. We've got the vibrator as well, which keeps her brain discombobulated. And this is the way you do Morpheus and get a great effect, so that tomorrow she'll be a little bit swollen. Actually, I may do something tomorrow to show you. We're wiping off the numbing medicine with alcohol. So this is how you do Morpheus, that it works the best. People are comfortable, they're happy, and they're happy with the visible results, the maximal visible results that you can get in one procedure with anything that is a maximal strength procedure. So Valerie's back to doing the rest of the face that is left. And we go circumferentially around the neck as well. Okay, here's our patient at the end of Morpheus. As you can see, she's been well Morpheused, and that's the degree of red that you want to see afterwards. A little bit of swelling, perfect amount of swelling. She was comfortable during the procedure. There was no screaming, there was no cursing. There was nothing but she was lying there because she was numbed. And the reason we use the reason that we use the vibrator and we blow the cool from the Zimmer machine on there is because that sort of keeps your brain diverted. So, and then we have the numbing medicine in the skin, we have the numbing medicine on the surface of the skin, we have the brain numbed with good sedation, so that people are generally snoring, sleeping through the whole thing. They're calm and happy. And then at the end of the procedure, we put everything, a poultice, as I like to call it, of skin products that, of course, are maximal strength and non-toxic all over the skin, because there's little holes all in the skin, and the skin just sucks it in, and that helps give the raw materials that it needs to start making new collagen. And then their instructions for continuing what they need to do for the next week, and then from then on, basically. Oftentimes I'll put a high-dose retinol peel on the skin after this. It's a great time to do one, because it just makes people heal faster, better, more collagen stimulation. So there's a reason that we do everything we do, and the stepwise fashion to providing you with maximal results. So it's the weekend here. Hope you all have a lovely weekend. Thank you so much. Bye.